Hello. Welcome back to our channel. In this video, we will explore the connection between grief and depression, and provide helpful tips on how to cope with both. We hope this information will be useful for anyone who is going through a difficult time and needs some support. Grief is a natural human response to loss, and it is a process that we all go through at some point in our lives. However, sometimes it can turn into something more complicated and difficult to manage, such as depression. Grief is typically associated with the death of a loved one. It can manifest as a range of emotions, including sadness, anger, guilt, and confusion. Depression, on the other hand, is a mental health disorder characterized by persistent feelings of sadness, hopelessness, and emptiness that interfere with daily life. While grief and depression share some similarities, they are distinct experiences. However, studies have shown that prolonged or complicated grief can increase the risk of developing depression. In some cases, the symptoms of grief and depression may overlap, making it difficult to differentiate between the two. It is important to note that grief is a natural and necessary process, and there is no right or wrong way to grieve. However, if the symptoms of grief become overwhelming and begin to interfere with daily life, it may be helpful to seek support from a mental health professional. Here are some signs that grief has turned into depression. Intense feelings of guilt or self-blame. Persistent sadness or emptiness that doesn't go away. Significant changes in appetite or sleep patterns. Difficulty concentrating or making decisions. Lack of interest in activities that were once enjoyable. Thoughts of self-harm. Feelings of worthlessness or hopelessness. Avoidance of social situations or withdrawal from friends and family. Physical symptoms such as headaches, digestive problems, or chronic pain. A sense of numbness or detachment from reality. Here are some ways to cope when grief turns into depression. Seek professional help from a therapist or counselor. Professional help can provide support and guidance to help individuals manage their emotions and cope with their grief. A therapist or counselor can offer tools and techniques to help individuals process their feelings, manage stress, and work through their grief. Join a support group or find a community of people who have gone through similar experiences. Being surrounded by people who have experienced similar loss can be comforting and provide a sense of belonging. Support groups offer a safe space for individuals to share their experiences and emotions, gain perspective, and receive support from others. Make sure to eat well, exercise, and get enough rest. Taking care of one's physical health is essential in managing emotions and stress. Eating a healthy, balanced diet, exercising regularly, and getting enough rest can help individuals maintain their physical and emotional health. Stay connected with friends and family members who can offer emotional support. It's important to maintain connections with loved ones who can provide emotional support during times of grief. Talking about one's feelings and receiving emotional support can help individuals feel less alone and cope with their loss. Try mindfulness or meditation practices to help manage difficult emotions. Mindfulness and meditation practices can help individuals manage difficult emotions and reduce stress. These practices involve focusing one's attention on the present moment, letting go of negative thoughts and emotions, and cultivating a sense of calm and relaxation. Allow yourself to grieve and process your emotions. Grieving is a natural and necessary process, and it's important to allow oneself to feel and process their emotions. This may involve crying, journaling, or talking with a trusted friend or family member. Engage in activities that bring joy and fulfillment. Engaging in activities that bring joy and fulfillment can help individuals cope with their grief and find a sense of purpose. This may involve pursuing hobbies, volunteering, or spending time with loved ones. Practice self-care and self-compassion. Taking care of oneself and showing oneself compassion during times of grief can be a powerful tool in coping with difficult emotions. This may involve engaging in self-care activities, such as taking a bath or reading a book, and being kind and gentle with oneself. Create a routine and structure for daily life. Creating a routine and structure for daily life can provide a sense of stability and help individuals cope with their grief. This may involve setting a schedule for work or daily activities, and prioritizing self-care and emotional well-being. Remember to seek help if symptoms of depression persist. If symptoms of depression persist or worsen over time, it's important to seek professional help. This may involve talking with a doctor or mental health professional, and exploring treatment options such as therapy or medication. In conclusion, coping with the loss of a loved one can be incredibly difficult and can trigger feelings of depression. It is important to seek support and take care of your mental health during this time. Remember that healing takes time and it is okay to grieve in your own way. If you find yourself struggling with depression, know that there are resources available to help you. You do not have to face this alone. Reach out for help and know that there is hope for healing and recovery. If you enjoyed this video and found the information helpful, please consider giving it a thumbs up and subscribing to our channel for more content like this. Don't forget to hit the notification bell so you never miss an update from us. And if you know someone who could benefit from the insights we've shared, please share this video with them. Thank you for watching and supporting our channel.